Good morning. Thanks, ladies and gentlemen, for coming. Today is another public information session. Over the past month, a number of health care issues have gained considerable public attention in the province. To date, we've discussed challenges related to general internal medicine, emergency room services, primary care, and psychiatry. Today, we're discussing the challenges facing rheumatology in Newfoundland and Labrador. Now, before I begin, I'd like to address comments made by Health Minister Jerome Kennedy in reference to last week's psychiatry information session. During question period in the House of Assembly, the Health Minister accused 3 psychiatrists of, quote, trying to paint a picture that is inaccurate. I want to take this opportunity to assure the Minister and the public that the issues we are bringing forward are true and they are accurate. They are real stories about real problems, about real people that affect physicians and our patients every single day. Joining me today are 3 of the province's 4 rheumatologists. Dr. Crashy to my far left, Dr. Hamilton to my left, and Dr. Proton Raman to my right. Arthritis, as I'm sure everyone is aware, is a very painful and debilitating disease that has a significant impact on a person's quality of life. I'm sure a lot of you have some elements of arthritis yourself, or you have family members that have arthritis, and you all know how incapacitating that it can be. We know that there are more than 89,000 patients in Newfoundland and Labrador who have been diagnosed with arthritis. Many of these patients wake up every morning in pain. They go to bed every night in pain, and they spend all of their days in pain, significantly affecting their daily activities, their ability to do things, and in many cases, just personal hygiene. This kind of suffering should not be dismissed. These people must not be ignored or forgotten. There's no known cure for arthritis. As physicians, we try our best to give these patients some comfort by managing their disease through treatments and in some cases through surgery. Orthopedic surgery is probably the most common type of surgical intervention for arthritis. It presents a viable alternative when attempts at non-surgical management cannot prevent joint pain or damage. As an orthopedic surgeon, arthritis patients represent a significant portion of my caseload. By the time they see me, many have undergone tremendous pain and suffering. We know that the number of hip and knee replacements performed annually is rising, and it is expected to continue to increase as our population gets older. The fact that many orthopedic surgeons are now operating at capacity is a clear indication that the system may not be able to respond to the projected increases of people with arthritis. In my own practice, I can think of a couple of patients who I've operated, one of which I operated on 2 or 3 weeks ago, a 42-year-old mother of 3. Severe inflammatory arthritis. We had to do a total knee replacement on her, and she's waiting to get the other one done, and was severely incapacitated, significant disability, and unfortunately she didn't have access to a rheumatologist, and maybe if she had seen the rheumatologist many years ago, it might have been helpful and probably delayed the disease process. I can think of another patient who had been in a wheelchair for 2 or 3 years and came to see me, and her daughter wheeled her in, and she wasn't able to do very much on a daily basis. She had a bad knee, and so we did a total knee replacement on her, and after being 3 years in a wheelchair, she came back at the 6-week mark, and I was delighted to say, she said, you know, I'm so pleased about the lack of pain that I have that I went out to the dance on Saturday night, and I had a dance, and so you can't imagine how good that makes you feel to be able to do something for patients and help them out. And of course, the patients are just absolutely delighted. The other thing that I want to comment about is patients that I personally want rheumatology to see, but the access to this service is very, very difficult, as you all know, and as Dr. Hamilton and his colleagues are going to talk about today. So these are real issues with real people, and this is something that I see on a daily basis and my colleagues see on a daily basis. The province's inability to recruit new rheumatologists, coupled with an aging population and a growing number of complex arthritis patients, represent all of the elements of a perfect storm. The time to take action is now. With only 4 rheumatologists serving the needs of the entire population, the system is functioning well beyond capacity and at a rate that's not sustainable. Scores of arthritis patients in the province do not receive timely access to medical services and are forced to endure unacceptable wait times. This can lead to increased joint deterioration, disability, and preventable suffering. Patients are particularly at risk if they live outside of St. John's, where there are no rheumatologists and where arthritis is the most prevalent component. This leaves the orthopedic surgeons and the family physicians to deal with these patients, and when we need help, we want a rheumatologist to help us, but very, very difficult to access. If government is committed to reducing wait times and improving access to rheumatology services without compromising patient safety, then it must ensure that Newfoundland and Labrador has an adequate number of rheumatologists with the right supports in place to meet our patients' needs. In recent days, Finance Minister Tom Marshall has repeatedly commented on the responsibility of government to protect the public interest from a financial perspective. But what about the government's obligation to provide the kind of care that all Canadians are entitled to? As physicians, we have a responsibility, indeed we have an obligation, to advocate for a standard of care that people living in Newfoundland and Labrador need and deserve. 4 rheumatologists serving the needs of the entire population is just not enough. We need more doctors. By having better managed pain and improved access to rheumatology services, we can expect less wait times, less hospitalizations, and reduce costs to the system over the long term. This also allows people to be productive in society and allows them to get back to their normal lives as best they can. But more importantly, it will mean improved quality of life for our patients.